Welcome back to Have More Babies. Today, we're tackling something really important for so many families, finding the absolute best way to care for kids with asthma.
That's right.
We've got a new study to talk about, some really interesting findings. Our plan is to break it all down, figure out what it means for you, and hopefully give you some clear, practical insights.
Definitely. And it's such a critical topic. Childhood asthma, well, it affects kids all over the world. And if it isn't managed properly, it can get serious.
Serious how?
We're talking potential hospital visits, or even in the worst cases, it can be life-threatening. So
Yes.
getting the care right is just essential.
Absolutely. Now, something we've seen change healthcare a lot recently is telemedicine. Getting medical help remotely. It's
Mm.
convenient, no doubt, and opens things up. But it raises a big question, doesn't it? Can virtual visits really replace seeing the doctor in person, especially for something like asthma in children?
That's precisely the question this new research looked into.
Hmm.
The study was published in the Journal of Allergy and Clinical Immunology in Practice.
Uh,
And it followed 125 kids with asthma for 6 months. What's really useful is how they set it up. They compared 3 different ways of getting care.
Three ways.
Yeah. One group used only telemedicine, another group had only in-person doctor visits, and the third group, well, they used a mix of both.
Okay, so a direct comparison. That's helpful. And how did they measure, how well the kid's asthma was doing?
They used something called the Asthma Control Test, the ACT. It's basically a standard questionnaire.
Right.
It helps figure out how often symptoms are happening, how severe they are, and how much they're impacting, daily life. So they tracked those ACT scores for all the kids over the 6 months.
Makes sense.
And importantly, they also tracked emergency room visits, any hospital stays, and asthma exacerbations.
Asthma exacerbations. And maybe just quickly define that for everyone.
Sure. Those are basically flare-ups, times when asthma symptoms suddenly get much worse, like bad wheezing, lots of coughing, trouble breathing. They can be really scary for the child and the family.
Right. Those are the moments everyone wants to avoid. So they tracked all that. What did the study actually find? What was the main result?
The big finding, really, was that the combined approach seemed to be the most effective.
A mix of both.
Exactly. The kids who got a combination of telemedicine and in-person care, they showed really noticeable improvements. Their lung function was better.
Okay.
They had fewer asthma attacks and needed fewer trips to the emergency room compared to the kids who only had telemedicine or only saw the doctor in person.
Wow. Fewer attacks and fewer ER trips. I mean, that's huge. That's what every parent dealing with this wants to hear. What about how the families felt? Were they satisfied?
Yes, satisfaction was also highest in that combination group. People liked the convenience, the easy access of telemedicine for regular checks,
Sure, that makes sense.
but they also really valued the reassurance and the kind of personalized feel they got from the in-person visits. It seemed like that combination really hit the sweet spot for them.
So, better control based on the test scores and happier families with the hybrid model. What about the other two groups, the ones with only one type of care?
Well, the study suggested they just didn't reach the same level of asthma control, and their satisfaction levels were lower compared to the group getting both types of care.
Hmm.
The data was pretty clear. Mixing both led to fewer of those serious flare-ups, those exacerbations, than just sticking to one method alone.
So it sounds like the real takeaway isn't about choosing one or the other, telemedicine or in person,
Exactly.
but realizing that putting them together, that synergy, might actually lead to much better results for kids with asthma and, well, happier families too.
Precisely. This hybrid model seems to offer that continuous monitoring and easy access through telemedicine, great for managing things day to day and catching issues early.
Right.
But then you still have those vital in-person visits for the proper physical exams, the detailed lung tests, and, just building that relationship between the doctor, the child, and the parents.
It really uses the strengths of both, doesn't it?
It does. And another potential plus fewer hospital stays and ER visits could mean lower healthcare costs overall. That's always a good thing.
Definitely encouraging. Now, with any study, it's good to look at the whole picture. Were there any limitations, things we should keep in mind?
Yes, absolutely. It's important context. First, the number of participants, 125, it's not huge. And it was done in just one medical center.
Okay.
So ideally, we'd want to see bigger studies across different places to really confirm these findings apply more broadly.
Makes sense.
Also, this study only ran for 6 months, so we don't yet know about the long-term effects. Does this combined approach stay effective over years? that needs more research.
Right, sustainability.
And finally, they didn't do a detailed cost-effectiveness analysis in this particular study. So looking at the economics would be another useful step.
Good points. So, promising results, but more work needed to be sure. Okay, the study also mentioned something about patient education being important in this hybrid model. Why is that so key?
Well, patient education is always crucial in asthma care, right? Understanding the condition, the triggers, sticking to the treatment plan.
Sure.
But when you bring in telemedicine, families often need to take on a bit more responsibility. Things like monitoring symptoms closely at home, communicating clearly through apps or video calls, maybe handling some simple equipment.
Like peak flow meters, maybe?
Exactly, stuff like that. Understanding the data they're seeing, and critically, knowing when they really do need to escalate things and seek more urgent help.
So it's about empowering parents and caregivers to be active participants. How does that education specifically help, connect the virtual and the in-person parts?
Well, if parents are well informed, they're better equipped to judge, say, when an in-person visit is really needed versus when a virtual check-in is fine.
Yeah, okay.
They can prepare better for virtual appointments, having the right information ready. They also understand the limits, knowing when, say, a doctor really needs to listen to their child's chest in person, especially during a bad flare-up.
Right, understanding what telemedicine can't do.
Exactly. And overall, good education just helps everyone commit more fully to the whole plan, taking medicines correctly, making lifestyle adjustments, all of it.
And I imagine having families who are knowledgeable and engaged probably helps the healthcare system too, right? Not just the child.
Oh, absolutely. Educated, proactive families can lead to more efficient care. Fewer unnecessary urgent visits, potentially fewer hospital stays because problems are managed earlier. It boosts self-management skills.
Yeah.
It really fosters that collaborative spirit.
It sounds really positive, this hybrid approach, but are there potential roadblocks, things that might make it hard for some families to actually use it?
Yes, unfortunately, there are some real challenges. A big one is simply access to technology.
You mean like reliable internet devices?
Exactly. Good internet, a smartphone or computer that's not a given for every family. So that's a barrier right there. Then there's just the comfort level with technology.
Tech savviness.
Right. Some people, maybe older caregivers, might find navigating the platforms a bit tricky, even if they're getting more user-friendly. Yeah. Insurance and cost are also factors.
Mm-hmm.
Do insurance plans cover these virtual visits adequately? Is it affordable? That varies a lot.
That's a big one.
And finally, applicability. Telemedicine just might not be the right fit for every child, especially those with really severe or unstable asthma who might need more frequent, hands-on, specialized assessment in person.
Those are really important points about making sure everyone who could benefit actually can benefit. It needs to be equitable.
Absolutely.
So for listeners thinking, okay, this sounds interesting, maybe it could work for my child, what's a good next step? Where can they find out more?
Well, if you're looking for more personalized information on how this combined approach could work for managing your child's asthma, I'd really recommend checking out omegapediatrics.com.
Omegapediatrics.com.
Yes. They have detailed information on their website about the services they offer, including how they integrate both telemedicine and in-person care specifically for asthma management.
Okay, great resource. So wrapping up, the main message from this research seems pretty clear, doesn't it?
It does seem clear.
That combining telemedicine with traditional in-person visits looks like the most effective way right now to manage childhood asthma.
It offers that convenience people want, but also the essential hands-on care and personal connection from seeing the doctor face-to-face.
Leading to potentially better health outcomes and, importantly, more satisfied kids and families.
Exactly. It's about optimizing care by thoughtfully blending these two ways of delivering it.
So if you want to explore how this kind of combined approach could help with your child's asthma, do visit omegapediatrics.com. You can find out more about their services and their team there in Roswell, Georgia.
And of course, if you found this conversation useful today, we'd really appreciate it if you'd like this video. Subscribe to the channel for more discussions like this.
Mm-hmm.
And please share it with anyone you think might find it helpful, maybe other parents dealing with childhood asthma.
Thank you so much for tuning in today for this really vital discussion. We hope it's giving you some things to think about and maybe some helpful ideas. Until next time, take care, everyone.